Welcome to the first ever So You Want to Work in Healthcare podcast. I'm Leah Barbieri. I'm your host, and you might know me from my TikTok account, Hello, I'm the PA. And I'm so excited because this is the first ever episode of the So You Want to Work in Healthcare podcast. And I have one of my favorite people and PAs here with me today. Her name is Heather Struhl. Heather is a physician assistant and registered dietitian. So let's get right into it.
I'm excited to be here.
Thanks, me too. I'm so excited. I wanted you to be one of my first because you have 2 degrees, and so you can kind of talk about 2 different careers in healthcare. And guys, the whole point of this podcast is to help you decide what career in healthcare would be best for you. I know there's so many things to choose from. We're both physician assistants, so we're obviously going to start with PAs. But this whole thing is just to help you and guide you in your journey into the healthcare field. All right, you ready?
Yeah.
Okay, so first, I already said you're a PA, obviously you're also a registered dietitian.
Yeah.
So let's start with what you're doing now. I know that you're currently working in plastics and why don't you tell me what you do?
Okay. So I work as a physician assistant for a plastic surgeon. It's a facial plastic surgery office, and I do the non-invasive aesthetic treatments. Right. So I spend my day doing injectables such as Botox, Dysport, fillers, and I also do collagen-stimulating treatments like microneedling,
cool.
And some other things, including chemical peels. I do see post-op patients, usually at their 1-week visit. So whether they had a rhinoplasty, facelift, earlobe repair, I'll take the stitches out. So that's pretty much what I do in my office. But I'm usually seeing my own patients most of the time.
Awesome. And so that is one thing that I think we're both used to as PAs. We get to see our own patients. So there's that aspect of autonomy in our jobs.
Absolutely.
And just so you all know, Heather has done my Botox and she's amazing at it.
Thank you.
It looks great. Real quick, also a little blurb about what I'm currently doing. I'm a physician assistant currently working in orthopedic surgery, and that's what I've done my whole career. That's actually how Heather and I met. We met in orthopedic surgery, and we'll talk about that a little bit later. So first, I want to know, Heather, when did you know you wanted to go into healthcare?
I think I always knew in the back of my mind that I wanted to do something in healthcare, and I spent most of my years in middle school and high school trying to figure out if I really wanted to go to med school. I didn't know what a physician assistant was at that time.
Same.
My dad's a cardiologist, and that's what I really knew, that track.
Yeah.
And I really just didn't know if that's how I wanted to spend my life, and it's a really big decision.
It is.
And it just didn't feel like it was the perfect match for me, and I didn't necessarily know why.
Yeah.
So I went to undergrad, I studied nutrition, and I just loved health in general. So that was a great focus for me to start with, and that's when I then learned what a physician assistant was, and it felt like it was a better match for me.
Yeah. I had a similar course, actually. Didn't really know what a PA was until college. I think I might have even been like a junior in college.
I think that's what I was.
Yeah. And my mom brought it up to me and she was like, have you looked into this? And I was already having second thoughts about going to med school. So, and when I heard about what a physician assistant was, I was like, that is the right choice for me. So yeah, so your dad is a cardiologist, you said.
Yes, and
awesome.
He never wanted me going to med school.
No way. So your dad, the doctor, did not want you to go to med school.
Yeah, he spent his life on call going into the ER multiple times a night, and he wanted me to have a little bit of an easier lifestyle.
Yeah.
And he said, if I wanted to go to med school, he would support me, but it had to be my decision that I wanted to do 100%.
Cool.
And I couldn't say that.
Wow, that's awesome. Cool dad.
Yeah, he's the best.
So you became a registered dietitian first, right? So what made you choose that in the beginning?
I was always super interested in health, science, and actually my mom had brought it up And this was back when I was in high school. One of our relatives is a registered dietitian. She has an amazing career, and she can meld so many aspects of science into her everyday life. And I just thought it was so interesting, but it's also an incredible background to have.
Yeah.
So a lot of what I learned undergrad in school really helped me when I was in PA school. I already learned about a lot of different diseases and metabolic issues. So it really was like incredible prep for PA school itself.
Cool.
And that's kind of why I took that route.
Did you work as a dietitian first?
For like a month.
A month?
Yeah.
Oh my gosh. Okay, cool.
I kind of went straight through school.
Yeah.
So when I knew I was going to start PA school. I had finished my dietetic internship about a month prior, and one of the registered dietitians that I was working with was going on vacation and asked me to cover. So that was really it, because I knew I was starting school soon after.
Okay, so you were around maybe a sophomore, junior in college. You found out about physician assistant.
Yes.
But you decided to continue on with your current major, which was what?
Nutritional sciences.
It was already nutritional sciences. Okay. So your plan originally was probably to do something with your dietitian degree.
Yes.
And then when did you actually start applying to PA school? Were you still in college?
I actually had graduated college. I was doing my dietetic internship on Long Island at a big hospital. I don't know if I'm allowed to say which hospital.
You can say you can say whatever.
Okay. So I was at Stony Brook Hospital doing the dietetic internship. And the reason why I wanted to complete that was because I had started that program, which was so great. And I really wanted to incorporate being a registered dietitian with being a PA. And I didn't necessarily know how I was going to do that at the time.
Okay.
But it was important to me that I finished that degree, so I had that under my belt. And also I was a little nervous at that time. As how I felt was, well, what if I don't get into PA school? It's so competitive. Yeah. And I just wanted to make sure I had something secure that I also enjoyed doing. And then if it took me a few years to get into PA school, I'd have that nice background.
Yeah, that's smart. That's really smart to have that to fall back on just in case you didn't get in. And, you know, it's even more competitive now. Yeah. But even when we were applying, I think we probably were applying around the same time. It was still pretty competitive. Yeah. Let's just talk real quick about the registered dietitian degree. How long was school for that?
So I did the 4 years undergrad, and then the dietetic internship was an additional year. Okay. And that was also something that you had to apply for. There was a matching program.
Oh, okay. So kind of like residency matching?
It's very similar to that. And you would do different rotations, and once you complete those rotations, you're eligible to sit for the boards at the end of the year.
Cool. I just realized I actually know nothing about how to become a registered dietitian. So this is really great to learn.
Yeah, it was a great program. It's pretty rigorous. You get a lot done in 1 year.
Okay. Yeah, I mean, we know about that. PA school is pretty rigorous.
Exactly.
We kind of already touched on this, but then I want to know what really made you decide to become a PA. Was it the lifestyle? Was it, the versatility of it? Like, what really grabbed your interest and was like, okay, actually, I'm going to do this after I become a dietitian?
It's actually all the above, what you just said. So I knew I wanted to be a PA, but how I really decided that this was absolutely the right choice for me was actually while I was doing my dietetic internship.
Oh, really?
I was doing a rotation in gastroenterology, and I was working closely with a registered dietitian. And this was actually in a bariatric surgeon's office. Oh, wow. And there's so much prep that goes into a patient undergoing bariatric surgery. The registered dietitian does a lot, and there's many other doctors that the patient has to see. But while I was doing that, I decided that I wanted to be in the surgery itself. Yeah. So I kind of knew that I really did need to do some further education. Yeah. And that kind of sealed the deal for me.
So it was surgery that really sealed the deal. Yeah. Yeah, I get that. Let's talk about what you needed in order to apply to PA school. You probably had most of your prereqs done, your prerequisite classes. Did you have to take any additional classes before applying?
I did. The only class that I didn't have was anatomy and physiology. Okay. Or maybe just anatomy at the time. But I went to Penn State undergrad. Nice. So anatomy wasn't a prerequisite for the nutritional sciences major. So that was the only thing that I was missing for PA school. But every school needed a different course. So there were just a few schools that I couldn't apply to just because I never took genetics. Right.
Yeah,
and
the
then take the extra
prereqs are a little bit different for different schools. So I think I went through a similar process where I was like, all right, I'm missing one or two for this school, so I'll just apply to that school instead. So, but that's great that you had almost all of your classes done with your dietitian degree.
Yeah, it made it super easy.
Great. And how many schools did you apply to? Do you remember?
I think I applied to 5 or 6
Okay.
back then. I didn't take the GRE. At
Yeah,
the
neither
time.
did I.
Yeah.
I was like, I am not going to take the GRE. Like, no matter what, I'm
Yeah.
only applying to schools that do not need the GRE.
I couldn't take one more test at that time.
Exactly.
I was so tired.
So burnt out already.
Yeah.
Like, yeah, no.
And
it
just,
was.
just the thought of having to prep for something else that,
Yeah.
in my opinion, didn't really have much to do.
It didn't have anything to do with medicine.
Yeah,
It had
not going to help you at all. So I just kind of applied around that, found the schools that didn't require it, and it worked out.
Good. Same.
Yeah, it's for the best. I think those schools now do require it, but there's a few that don't.
Yeah, and I think there's a new test. It's like a PA CAT or something.
Yes.
Did you hear about this?
I did.
Yeah, I don't really know much about it, but maybe our listeners can tell us more about it because we're not like spring chickens here. We applied to PA school when? Like I think I applied in 2009.
That's when I did. Yeah.
Yeah.
It was 2008
graduated.
or 9. While I was doing the dietetic internship, I had just graduated college. I think I'm a year or two older than you.
Maybe.
Something like that.
Yeah, something like that. We're about the same age.
Yeah.
Yeah, so this was, keep in mind, this was like 2009. A lot has changed since then, but hopefully we can still give you some insight. All right, yeah, so 5 or 6 schools. I think I applied to only 3 schools. I just knew I wanted to stay in New York City, and I kind of figured if I didn't get in, I would just find something to do for a year, and then reapply. But luckily, I got into one school.
That's all you need.
That's all you need.
I only got into one as well.
Where did you go to PA school?
I went to Long Island University in Brooklyn.
And did you like it?
Yeah, I thought it was a great program, and we had really great professors. They taught at a couple of different PA schools in New York City, and it was a great experience. They prepped us well.
So you had one didactic year, and then a year of clinicals.
Yes.
And how many clinical rotations do you have? Do you remember?
I want to say maybe like 8 or 9. It could have been more.
Say 9.
And then we had one elective. I ended up doing general surgery again. I tried to do plastic surgery at the time, but the paperwork didn't work out in time.
Okay.
That's what happens.
Yeah, we only had one elective as well. I feel like the students these days have at least 2 electives.
I think it depends on the school.
Yeah. The students that I precept or end up coming across, usually they have at least 2, which is nice. I would have liked to have 2.
Yeah,
we only had
as
one.
Well.
A really important question that people always ask is, how much does PA school cost? Cost is a huge deal when considering a career in healthcare. You don't want to be paying loans for the rest of your life. Trust me, I've been paying them for the last 12 years. It is not fun. So do you remember how much your school cost?
I think it was about $80,000 for the 2 years.
Okay.
And at that time, my program was not a master's, so it's a little bit more now.
Right. Now most programs, I think all programs have to be masters now. Is that right?
I think so.
I think that's the case. Mine was similar. I think it was in the 70s, but same kind of similar cost, about $35,000-$40,000 a year.
Yeah, that seems appropriate.
And PA school, in case you don't know, is usually around 2 years. There are some 3-year programs. I had a friend who went to a 3-year program. She had her summers off. That was nice. Our 2-year programs, I'm assuming yours was the same. We basically go straight through. I went from July of 2010 to August of 2012.
Mine was about the same. I think we had maybe 2 weeks off.
Yeah, 2 weeks for like Christmas.
Yeah,
right?
Just between the 2 years. I think right before we started the didactic year. But honestly, it was intense, but it was better that way because I couldn't really relax during that time off. We were just anxious to start everything. Yeah.
Tons of exams. Didactic year is tough, but once you get through a didactic year, clinical year is so much better. You get to get your hands on into the nitty gritty of like medicine and surgery and everything you've been excited to do. So just get through, if you're in PA school, just get through didactic year and you'll be fine.
I agree.
Yeah, you agree?
Yeah.
The other thing I think is really cool, tell me if you agree, is once you're out of PA school, you can choose to either start working right away or do a residency. And I know you did a surgical residency. Do you want to talk a little bit about that?
Yes.
Okay.
So I did a surgical residency PA program at Geisinger Medical Center in Danville, Pennsylvania. I don't believe that program is still open to PAs, but it was a great experience. And I chose to do it because I did want more surgical experience in the OR. I was a little bit timid coming out of PA school, and thinking about starting a job in a hospital was just, it made me a little nervous.
Yeah, it's overwhelming.
It is overwhelming.
Yeah.
And I just felt like I wanted more experience, more training. And that's kind of how I've always operated as a PA. If I'm not really sure how to do something, I'm going to find help or find someone to show me.
Right.
And I think that's the best way. So that's how I felt much more comfortable. And it was a great experience. I spent most of my time in the OR.
Cool.
I had so much time suturing and just feeling really comfortable. So that way, when I did start my first job as a PA, I was super comfortable right away.
You felt ready.
Yeah.
And your first job as a PA was in orthopedic surgery. I know this because we started around the same time at the same job. Heather actually trained me, and we had a great time together. But tell me how you decided on orthopedics, because your surgical residency, you saw all different types of surgeries.
Yep, it was general surgery, so I got many different experiences there. I did do plastic surgery at that time, so I always knew that I wanted to end up in plastic surgery.
Yeah.
But during my orthopedic surgery rotation, I just really enjoyed it, and I ended up working one day with one of the sports surgeons. And at that time, his PA was about to go on maternity leave, so he did need some extra help. And one day I just started working with him, and he asked if I would stay. So I spent my 2 months in ortho basically with this one surgeon, and then I ended up doing my elective with him. I was originally supposed to do bariatric surgery.
Oh, wow.
Which is why I actually went to
Yeah,
I did. I wanted to do the surgical residency program because I didn't get any bariatric surgery experience during our clinical rotations in PA school. So that particular surgeon, the sports surgeon, offered me a job. But I ultimately wanted to move back to New York City to be closer to my family.
Right.
So that's how I got set up with the hospital, the position where we met, and that was actually through that referral.
Cool.
Yeah.
That's awesome. I never knew that.
Yeah.
Okay, so that brings me to why you decided to then do something else and go into plastic surgery, aesthetics. It seems to be a very popular thing to do these days, but you did it how many years ago now?
About 5 years ago.
5 years ago. I feel like every time I turn around, somebody I work with is all of a sudden in aesthetics now. But tell me why 5 years ago you decided that this is what you wanted to do.
I always had an interest in plastic surgery, especially because I did some plastic surgery during the surgical residency program.
Yeah.
So I always knew ultimately that I would end up back in that. And I actually thought my first job in general would be in plastics. That was after I decided that I didn't want to do bariatric surgery.
Right.
Different story. But so I always had that interest in it. And I actually thought about doing injectables on the side while I was working in ortho because I just also had that interest. And I do find that a lot of ortho PAs have an overlapping interest in aesthetics.
Yeah, it's weird.
Yeah.
I wonder why.
I think that
The hands-on aspect, maybe?
Yes, it's definitely the hands-on aspect because we never really sit at a computer that much other than writing notes and so forth. And we like to be doing things with our hands.
Yes.
And in ortho, we're fixing things.
Right.
But in aesthetics, you're augmenting and you are helping, certain muscular groups with different neuromodulators, and there's so many different things that you can do, but you're you aren't necessarily fixing and thinking about the anatomy.
Yeah.
So I think there's a lot of overlap.
Yeah, it's very anatomy forward, and yeah, that makes sense. And by the way, Heather and I are very much hands-on type of PAs. You do not have to work in surgery to be a PA. I think most PAs probably don't work in the surgical field, but if you do like that hands-on type of situation, ortho is great, and I think plastics is great for that.
Yeah, I agree. And I just think us particularly, we just like to be moving all the time. We're just not people that generally sit still.
Same.
We're both spinning our chairs as we sit here.
We are. I'm like, oh, stop spinning.
Yeah, I'm trying not to do a full circle.
It's true, though. That's a great... I never thought about why there would be so much overlap, but it really makes sense. Okay, so what do you love about your job now, about plastics and doing injectables and all the cool stuff you get to do every day?
Oh, wow. There's so many things. So I love that there's so much creativity with everything. So I like to say there's a science and an art to it. And then there's a lot of injectors that don't like that saying as well. But I think that's really how I feel about it, because anatomy is the most important thing. You need to know the muscle functions and also vasculature. All of these things are,
nerves.
Exactly. All of this is really important. But also you need to think about, like when I say the art, if we're augmenting, we want to think about facial harmony and balance. So there's so much consideration that you have to plan for when you're doing these treatments. So that's one of my favorite things. But also when a patient comes into you in aesthetics and they're confiding in you, there's something that they notice on themselves that they want to fix. And that's like a super intimate moment, I feel like.
Super intimate.
And they may not want to share that with their friends or family. And these are really private things. And we want to do things that are going to help them feel better about themselves. And that's what I say to my patients. It doesn't matter what anyone else thinks. It matters what you think.
Right.
And if something bothers you and you want to do something about it, whether it's just you're going to clear up your skin or focus on collagen stimulation, that's what matters, is that you're happy.
Yeah.
So I like making people happy, just like back in ortho.
Yeah. I think that's why we all go into healthcare, is to make people happy, make people feel better, and make people comfortable.
Yeah.
Right? And I think if you don't want to do those things, then don't go into healthcare.
Yeah.
Yeah. What do you not enjoy? If anything, you don't have to say anything, but is there anything you don't enjoy about the world of plastic surgery, aesthetics? Is there something you might change about the field? What do you not like about it? What is something you can tell our viewers and listeners who might not get this information from anywhere else?
That's a really great question. I feel like there is just an overall thought or mentality that doing these treatments, or any treatment rather, where you're focusing on beauty in general, whether it's your skin health or just augmentation, things of that sort, I think it often gets a bad rap. And more so because I don't think people really understand what we're doing or what that entails.
Yeah.
And I think people may not really know enough and just kind of write things off and then judge other people. And I do think there has been a lot of progress in the past few years in terms of judgment. People have become more open about talking about any treatments that they do, whether it's just Botox. And I don't think anyone has to talk about it if they don't want to. But as there's more education and understanding of what these treatments do for our skin, I think that kind of is helping to pave the way.
I agree.
More acceptance.
Yeah, I mean, I'm not even in the field, and I can see that it's changing. And it's, even with myself, like when I first got Botox, I was like, I didn't want to tell people. I didn't even want to tell my boyfriend. And then that recently I just made a video about of myself getting Botox. So I've even changed my mentality of it in the last 2 years or so. And I love when people come out and talk about it and are so open about it. I think that's what people like so much about these influencers like Alex Earl and people like that, who are so open with their skin problems, their skin augmentations, if that's how you say it. And it's cool. It's cool when people are just so like candid and intimate about that stuff.
Absolutely. And I think it makes people more comfortable. And then also seeing the video of someone getting any treatment done and seeing their results is educational in itself. And it's no one promoting, saying, well, because I got this, you should do this. They're just kind of telling their own story. And I just had this actual conversation with one of the influencers that I treat. And that person gets a lot of flack from some followers, and they're judgmental.
Yeah.
But in reality, what we were talking about is that you're just kind of telling your own story.
Right.
You're not saying that anyone else needs to do this. You're saying this is what I do, and you're just kind of sharing it like an open book. And I think that's great, and it helps so many people. And I see so many patients that come in, they say, I saw someone that got this done. I want to learn more.
Okay, so I'd like to talk salary a little bit. I get a lot of salary questions on social media, and we don't have to talk specific numbers or anything, but let's talk about if you know what the average salary for a plastics PA or I think it can be different, right? Like there are PAs who just go into aesthetics, like salon kind of Botox injectables, right? And then there's someone like you who's in plastic surgery and doing injectables. So On average, someone in New York City, what would you think if you could give a number or a range?
It's so different. The compensation is a little bit better when you're working in aesthetics of a sort, because there are things like Botox and fillers that insurance doesn't cover.
Yeah.
So it's very, very different. But there's different ways that you'll get compensation. A lot of PAs will have a base salary and make a percentage of either their gross or net income.
Okay.
And that really differs from office to office. So it's hard to say. I think there were some statistics that I saw not too long ago that the average, and I'm not sure if this is New York City or New York State or whatnot, can be closer to about 150K, but it varies so widely per practice. And some practices can be double, triple. It just depends on the patient population and the patient load that comes in essentially and how busy they are. So there's such a wide variety.
In doing some research, I've been seeing all different salaries, like for orthopedic PAs, anywhere from something as low as like 110,000 a year to 215. I saw 215,000 the other day posted, which I haven't seen much of that. Where I have seen it is in California. I've been noticing that a lot of the California PA jobs in orthopedics are offering higher salaries. And I think New York is starting to catch on. I work about 50 hours, on average. There might be weeks where I work less than that. There might be weeks where I work more than that. What would you say on average you work?
Currently?
Yeah.
What I do now, it is closer to 40 hours.
That's nice.
Because we do have more control with that. And then sometimes I'll stay late if a patient can't make it in, and you know, we'll set something up special, especially for them.
Yeah, that's nice.
But it's a little bit different in my realm now.
So I guess that would be a plus to going into plastics or aesthetics. If you're in a similar situation, it's a little less hours, a little bit of a better lifestyle in that aspect.
It is a much better lifestyle.
Yeah.
Yeah, and you're not waking up at 6 a.m. to be in the OR.
That's true.
Yeah.
That's true.
A little different.
So let's just say, based on how much money you had to put out for PA school, and I don't know what what the deal was. I don't know if you had loans or what. And compared to the salary you made starting out and at 5 years and now, would you say going to PA school is worth it?
Absolutely.
Absolutely.
I think it's one of the best decisions I've ever made.
Same.
And I don't regret anything about the course that I took to get there. Cool. I think becoming a registered dietitian was so important and vital for my career in terms of the education and getting to the point of feeling comfortable.
Yeah.
And it was such great prep. And even though it was some extra years, that doesn't matter.
That doesn't matter.
Yeah.
You're here now.
Yeah. So I would do it all again.
Yay.
And whenever someone asks me what they should do, I always ask them, well, what do you ultimately want to do?
Yeah.
And, maybe PA, the route is great for you, or maybe something else, maybe RN, NP, CRNA. But
CRNA is cool.
I would do it again, but I'm glad I don't have to go back to school and do it all again.
Yeah, same. I don't want to go back to school ever.
No.
Forever.
I think I'm good. I feel like I'm too old for this. Yeah.
One of the last questions I want to ask you is, what is a piece of advice that you could give anybody who wants to become a PA or thinks they want to go to PA school? What's one good piece of advice?
I would definitely focus on getting some healthcare experience, whichever way you can. Okay. Whether you're working in a research lab, you're just volunteering at a hospital or a doctor's office, it's really important to get those hours in because different schools will require a different amount of hours, but you do need that experience. And it is really vital as well because that will help you determine if this is really what you want to do.
Yeah. Yeah, that's so important. And I'm really glad you brought that up because I know I keep saying this, but one of the most common questions I get on Instagram is how many patient care hours did you have and what did you do? Mm-hmm. And everybody's experience, I think, is different. Different schools ask for different amounts. I've seen schools ask for up to 2,500 hours. That's a lot of time.
It's a full-time job.
What did you do did your dietitian internship count or?
That did. But even when I was in college, I worked in a diet study lab.
Oh, cool.
So I worked there for about 2.5 years. So all of those hours counted as well.
Awesome.
And actually, that job itself helped me land the dietetic internship.
Wow. So everything lined up for you.
It really did.
Yeah.
It was incredible.
So
Yeah.
cool. And it really is about the connections you make and who you know. I think I got my first job because I had somebody who I went to PA school with was working there, and I had become friendly with the person, and they referred me. So it really is a lot about who you know and like the different experiences you have. For my patient care hours, because I know everyone's wondering, I actually worked in the athletic training room at Fordham University, where I went to college. Yeah. And I worked there for like 3 years at Fordham, and those were basically most of my hours. The other way I got patient care experience was I volunteered in an operating room in the, over the summer. And I just basically transported patients and helped with whatever needed.
Oh, wow. That's a great experience.
Yeah, it was awesome. I got to see my first orthopedic surgery there.
Oh.
I remember it was a hip replacement. I was like over the moon the first time I saw it. I remember like running down the hallway to like jumping and like clicking my heels together because I was like so excited. It was like straight out of an 80s movie. It was amazing.
Was this your first surgery that you saw in
Ever.
person?
Yes.
Then that was ortho.
Yeah.
No way.
Yeah. So that's probably partly why I decided I loved ortho. Okay, so that was a great piece of advice. Definitely get your patient care hours. It is probably the number one thing that schools look for on PA school applications. I'm going to start wrapping up this session. I think that this has been awesome.
Yeah, this flew by.
It flew by. Thank you so much for being my first ever guest on my first ever episode of this podcast.
Thanks for having me.
You were amazing.
You too.
And also, I want to let our viewers and listeners know that if you do want to dabble in some Botox, you need to get a treatment, you're due for a facial, whatever it is, I definitely would recommend checking out Heather's office. She works with Dr. Westreich,
a facial plastic surgeon.
He is a facial plastic surgeon on the Upper East Side in New York City. What's the website? Do you have a website?
It's newfaceny.com.
Okay, so newfaceny.com. So you can go to the website, get all the info you need there. If you do want to make an appointment, you can say my name, which is Leah, and you'll get $50 off your first treatment as a new patient.
And you can check us out on Instagram if you'd like to see some before-after photos, which we also have on our website for the office. My Instagram is Heather the Injector _NYC, and Dr. Westreich's is newfaceny.
Yeah, she's got an awesome following on Instagram. Oh, and what I didn't say is she is the injector to the stars. There are definitely some celebrity clients she's got going on. So Heather's the real deal. She's not, only an influencer and an amazing PA. She's a very well-established clinician, and I'm really lucky to have you on my podcast.
Well, thank you so much for having me. This was my first podcast.
Yay, it was?
Yeah.
Oh.
Super exciting that I get to do this with one of my good friends that I feel like I've known forever now.
Well, it was great. Thank you so much. And I feel like there's so many more good things to come, and I hope I can have you on the show again in the future.
Yeah, that'd be great.
Thanks for watching my first ever episode of So You Want to Work in Healthcare. You can follow me at Hello, I'm the PA on Instagram and TikTok. If you are interested in becoming a PA, I hope this was helpful for you. Even if you don't want to work in healthcare, I hope you had fun listening to our show. And definitely stay tuned for more episodes to come.